We go now to our reporter, Laura Windsor, who has more information on early breast cancer detection.
Roger, the goal of mammography is the early detection of breast cancer, but when should a woman start having this type of test? We spoke with Dr. Gary Levine at Hoag Memorial Hospital Presbyterian in Newport Beach, who explains the importance of mammography for women 40 years and older.
Mammography for older women, older than age 50, there's no question that it's extremely effective and is the gold standard for detecting breast cancer early. The question is whether that extends to women under age 50. And the reason for that is younger women tend to have dense breasts, and the breast density can obscure a cancer. And we know that that's the case, and we know that we can't see all breast cancers in women under age 50. However, we routinely diagnose women under age 50 through mammography. So no really large, well-designed clinical trials have been done until recently to look specifically at women in that age 40 to 50 range. Recently, a study has come out of Sweden where national health care exists. Essentially, all women have mammography routinely. And because they didn't have data for under age 50, just like the rest of the world, about half of the country they started at 40, and half of the country they started at age 50. And now with 15 years experience, they've just published a few weeks ago in Cancer Journal the results of their trial, and it shows that the mortality rate from breast cancer was reduced 30% in the women who started screening at age 40 as compared to 50. So this really is real data on a true population, and it shows that there is a rather dramatic effect from starting screening earlier. We want women to have their baseline mammogram at age 40 and then have routine annual mammography yearly after that. It is still the gold standard for detecting breast cancer early, and that's what saves lives.
Dr. Levine, are all mammograms the same?
All mammograms aren't the same. So the quality of the mammogram is very important. You want to make sure that where you're having your mammogram has the latest in technology. About 60% of mammograms throughout the country are done with digital mammography. This is simply a better mammogram. But there are still a lot of places that use film screen. It's better than not having a mammogram, so if that's your choice, then definitely have a film screen mammogram. But if you have the opportunity to go to a center that has digital mammography, I think it's a better choice for patients.
We asked Dr. Levine to tell us about the next generation of breast imaging.
Because of the limitations of mammography in women who have dense breasts, a lot of the research that's ongoing right now has to do with other ways of imaging these young women with dense breasts. One of these technologies that we're studying here at Hoag is called digital tomosynthesis. And this is, it can be thought of as a 3D mammogram of the breast. So similar to a CAT scan, we're actually taking slices through the breast as we image so that we can remove that problem of the superimposition of dense breast tissue, basically peel off the layers of the breast tissue to find that possible underlying cancer. The FDA recently looked at this technology, and it looks like it will be approved for general use probably within the next 3 to 4 months. We believe that this is going to prove very, very valuable for imaging women with dense breasts and will be the next generation of mammography.
According to the National Cancer Institute, women aged 40 and older should have a mammogram every 1 to 2 years. For the American Health Journal, I'm Laura Windsor.